Welcome to the 4th Statewide Latino Health Summit. Please welcome our Master of Ceremonies, Inés Olaveria.
Good morning, everyone. How are we feeling today? That's what I like to hear. Good morning to each and every one of you, and good morning to our folks who are watching us live from their homes. It is an absolute honor for me to stand before you and officially welcome you to the 4th Annual Latino Health Summit. Here in Bethlehem, Pennsylvania, I am very excited to stand before you as we embark in this transformational journey together. Today, we gather as a united force, ready to empower Latino communities and to champion health and wellness for all. And as we kick off this momentous occasion, I really want to encourage you to open your minds, open your hearts, and really get the most of this experience, get the most of this event. This is why we're here. We're here to learn, we're here to make connections, and we're here to have fun. And now, without further ado, allow me to welcome to the stage a visionary leader who I admire and whose passion and commitment has been instrumental in bringing us all together here. Please welcome to the stage the President and CEO of Color and Culture, Mr. George Fernandez.
Wow, this room looks stunning from up here. I'm so happy that we're finally here. I'm happy to have some amazing esteemed guests joining us today. I'm excited that the event is oversold. How amazing is that? This event is oversold like a Delta plane. Yes, I love it. So good morning, buenos dias. Ladies and gentlemen, it's an honor to officially welcome you to the 4th Annual Statewide Latino Health Summit. This is a date that I've been looking forward to since we selected Lehigh Valley as our host location for 2024. And what a fantastic host you have already been. I'd like to first acknowledge the people and partnerships who have made this event possible. Thank you so much to our colleagues and friends at Aetna for being our presenting title sponsor for this amazing event, our colleagues and friends at Geisinger and CHOP, the Children's Hospital of Philadelphia. Thank you so much for believing in this event and for valuing the impact that we are making on health for our most vulnerable populations. For those in the room who do not yet know my story, I'd like to share the very humble beginnings that ignited my passion and fueled my drive for initiatives like the Latino Health Summit. At 8 years old, I immigrated from the Dominican Republic to Harrisburg, Pennsylvania, with my single mother, who is a survivor of domestic violence and spoke no English. I had to quickly adapt to the American language and culture to help my family navigate and survive this enormous transition. Picture this. At an age where most kids can live a carefree life, I was the male leader in my family, learning how to break through the social barriers that made daily living a constant struggle. I had to translate and communicate for my family and essentially help them advocate for their basic needs, all while facing the climaxing challenges of a truly broken system, where my family never qualified for social assistance programs, as we were not yet US citizens. This formative experience made me relentlessly passionate about helping vulnerable and underserved populations by giving them every opportunity to access resources and education that elevate their quality of life. And this is exactly what we are doing here today. Over the last 6 years, the Latino Health Summit has made an impact on thousands of lives across the Commonwealth, and we're just at the beginning of what is now a legacy of impact that this event is already creating. And here's truly the best part. It's you. You are now a part of this legacy too. Whether this is your first or fourth Latino Health Summit, you have taken the important step of showing up and walking the talk. And for that, I am immensely grateful. This year, I am proud to say that we are pushing beyond limits. We are fueling a revolution of change built upon pillars of empowerment where individuals are inspired to embrace their potential and take charge of their health and wellness. It's a revolution of advocacy where unheard voices are amplified and systemic injustices are confronted head on. Moreover, it's a revolution of solidarity, uniting us to ensure that every Latino in the Commonwealth receives the care, support, and the opportunities they deserve. And at the very core of this revolution lies the power of inspiration to defy all the odds, to challenge the status quo, and to effect meaningful change. Each and every one of you gathered here today is a testament to that power. Your dedication, your passion, your unwavering commitment inspire us all to reach greater heights, to push harder, and to dream bigger. But friends, let us also remember that the true revolution is not born out of one individual's efforts alone. It is born out of unity, of coming together as a collective force for good. Today, as we engage in dialogue, exchange ideas, and forge partnerships, let us do so with a spirit of collaboration and cooperation. Let us harness the strength of our diversity to fuel the flames of change. I am humbled by the opportunity to lead this initiative, but I am equally inspired and grateful to each and every single one of you. Our advocates, our healthcare professionals, our sponsors, our speakers, and our community leaders. You are truly a remarkable group of individuals, each with your own sphere of influence. My charge to you today is this. As you enjoy the conversations, networking, and presentations at this year's Latino Health Summit, carefully consider how your influence can align with our shared mission. We are all uniquely equipped to make an impact. Can you provide funding and resources? Can you create job opportunities? Can you advocate for change? And can you make a seat at the table for the underserved populations to be better represented? Can you speak up against unconscious bias and systemic racism and other uncomfortable topics that are all too often avoided? I know it's a tall order. Believe me, I know because I've been in that room. But I also know that you are here because you are a change maker. So together, let's ignite change. It starts here and it starts today. And before I close, I would like to recognize and celebrate the incredible work of my amazing team at Latino Connection and Color and Culture and its staff and the vendors who are the heart and soul of this event. You have poured countless hours into making this initiative a complete success, and I am deeply indebted to your commitment and dedication. And please know you are changing lives. You are making impact far beyond what you may see today. I'm thrilled for our amazing partners. This event is being televised by PCN, Pennsylvania Cable News Network, reaching 2.5 million Pennsylvania households. And I'm really excited that it all starts here today. I'm excited to see our next speakers. I'm excited to see the secretary panel. Really happy to have some amazing speakers lined up for you today. And I can't wait to see the public and private partnerships that will come together from this event. Thank you so much. Gracias. And welcome to the 4th Annual Statewide Latino Health Summit.
And now we welcome to the stage Dr. F. Miguel Fernandez, Chief Medical Officer, Aetna Better Health.
Good morning, everyone. Buenos dias, and welcome to the Latino Summit. George, I can't tell you how thankful and how honored I am to be asked to say a few words on behalf of the summit and on behalf of Aetna and Aetna Better Health. You asked me last night to share a little bit of my personal story, so I'll do that. Yesterday is a day that I always usually celebrate privately with my sisters. It is a day that, of great pride. It's the day that my mother and father escaped Cuba from Castro's regime to give our family an opportunity for a better life here in America. So I am the first one in my family to graduate from college, and let alone have an advanced degree. So very, very much intent on not letting the toils and sacrifice and the risk that my parents took to bring us to freedom to go to waste. So with that said, I am the Regional Chief Medical Officer for Aetna Better Health in the Northeast. I assumed that role about 4 or 6 months ago, working closely with Jerry Mamano, who is a fantastic leader for the region. in an effort to really change the landscape of how we are caring for our underserved communities. You know, we talk a lot about what the problems are. We don't talk enough about what solutions are. And my goal and my job is to bring solutions, but do it in a way that transcends across not only medical, but behavioral, social determinant, health equity. As a son of an immigrant family in Northeast Florida, I lived that experience. I know what it's like to not have things and want things and have basic needs not met. I know the toil and the struggle and the pain and the anguish that occurs when you're trying to do these things and you just feel like there is no open door. That's one of the reasons I decided to go into healthcare and then later transition into managed care, because I knew that in my practice, I was doing retail medicine. I could help 20, 30 patients a day. That's all I could do. On the managed care side, I build programs. I do population health programs. I can do wholesale medicine and do things that help thousands of people at the same time. So very proud of the opportunity to do that kind of work. And I know that with the sponsorship and the partnership we have with the Latino Connection and the Summit, it's something that we're very proud of. It's something that is core to our beliefs in alignment to help our underserved communities. It's a big deal. It needs to be treated like a big deal. It needs to have not only the recognition, but the funding, the muscle, and the attention behind it to make a difference. There are too many people that are suffering, languishing with healthcare right at their fingertips, but they can't make that last little jump to solve their problems. That is a sin. Honestly, that is just a sin, and we need to do everything in our power to improve that. Our job is to provide sponsorships so that these great events can occur. And if you look around, one of the things I'm very proud of is the Cube. Have you seen the Cube? Can't miss it, right? What a phenomenal testament to the dedication and the support we have for the Latino Summit. So I know that only have a few minutes, but I wanted to let you know that later on I will be on the panel talking about malnutrition and food as medicine. It's probably the most important thing that someone needs in terms of their Maslow's hierarchy of basic needs. You can't address psychological needs. You can't address physical needs. You can't address employment, socialization. You know, if you don't have basic needs met, food, water, shelter, you know, those types of things. And too many of our people, too many of our Latino brothers and sisters, regardless of whether they came from somewhere else and immigrated here or were born here, are still prisoners. Even though they're in a free country, they're prisoners because they don't have access to health care like they should, and they don't have access to the basic needs that they need to have. Our goal, in partnership with your organization, is to help fix that. So know that we are dedicated, we are committed, and we are very, very proud and honored to be a sponsor. And I personally am thrilled and honored to be invited to be part of this organization. Thank you very much.
It's time to put a different spin on how healthier really happens. Because when it comes to being healthier, it's more than you do you and she does she. The real secret, baby, is how we do we. Healthier is not something that happens all alone. It takes Greg and Lydia and Josie on the phone. It's Grammy getting checked on in her favorite chair, or darling herself up to go handle all of her care. And when Nia has so much to do, she doesn't even know where to start. There's a sweet surprise there to warm her heart. The doctors to nurses and all the people in between. Healthier happens in more ways than Ray's ever seen. From mental health to superpower stealth, or jumping online just to make sure they're fine. Healthier happens together.
Our next guest is an awarded educator and author, trusted partner in the Latino community, and board chairwoman for the Latino Connection Foundation. Please welcome to the stage Dr. Sarah Ramirez.
Hola, hola, buenos días. Hello. Is it on? Good morning, everyone. I'm Dr. Ramirez, and I'm very honored to be here and to be the board chairwoman for the Latino Connection Foundation. Yeah. And for the board members who are currently here, I'd love for you to stand up. I know Amber's out there somewhere. So I'd like to continue the welcoming this morning, and it is my absolute honor to welcome you to the 4th annual Latino Health Summit hosted by Latino Connection. Today, as previous speakers have said, we're gathering not just to discuss the future of healthcare in our communities, but to celebrate a milestone that marks a significant leap forward into our mission to empower underserved populations. The Latino Connection Foundation was founded in late 2022, so we're young. And we're driven by a vision of a world where everyone, regardless of their background or economic status, has access to essential services that uplift and support their well-being. Our commitment to this vision has recently been recognized through our certification as a community housing development organization, otherwise known as CHODO, a distinction that speaks volumes about our dedication, expertise, and the trust placed in us by our community and partners. Achieving this certification is no small feat, and it positions us as the only CHODO certified affordable nonprofit in Dauphin County. This is a testament to our unwavering commitment to not just meet, but exceed the highest standards of community development and support. This certification opens new doors for us to expand our impact, particularly in the realm of affordable housing. It empowers us to create spaces where families can thrive, where seniors can live with dignity, and where children can grow in a safe and loving home. It is a pivotal step forward to realizing our broader mission of enhancing access to healthcare, affordable housing, and economic development opportunities for Latino and other minority groups throughout Pennsylvania. Our projects, whether they're focused on health services, affordable housing initiatives, or economic development programs, are designed with the community at heart. They're not just initiatives. They're lifelines for the individuals and families they serve. They're beacons of hope in our collective effort to dismantle barriers that prevent our communities from accessing the care, support, and opportunities they so rightfully deserve. And as we move forward, let us take a moment to reflect on the significance of our gathering here today. All of you here today are contributing your passion to these shared initiatives. The Latino Health Summit is more than just an event. It's a manifestation of all of your collective strengths, all of your passions and resolve to create a healthier, more equitable future for all. It's a platform for sharing ideas, forging partnerships, and drawing inspiration from one another as we navigate the challenges and opportunities ahead. And I challenge all of you this morning to enjoy the summit, but also forge new relationships and partnerships and network and sharing your passions. I want to extend my deepest gratitude to every one of you for joining us in this journey. Your presence here today is a powerful reminder of the impact we can achieve when we come together, united by a common purpose, driven by a shared vision. Together, we are making history. Together, we are building a legacy of empowerment, of inclusion, of progress. I want to thank all of you for being such an integral part of this transformative journey. And as we chart the path forward, we invite you to join us in a deeper partnership across our three core areas: health services, affordable housing, and economic development. If you or your organization are passionate about these and making a tangible difference in these vital sectors, we are welcoming the opportunity to collaborate with you, Your expertise, your resources, your vision can amplify our efforts and help us reach new heights in serving our communities. Please reach out to us at Amber Borelli at latinoconnection.org. I apologize, A. Borelli at latinoconnection.org to help explore how we can work together to create lasting change. Whether it's through collaborative projects, sharing our resources, or any form of support, every contribution matters and every contribution counts. Let's harness our collective strength and build healthier, more sustainable, and equitable communities for all. We look forward to your partnership and the remarkable journey that lies ahead. Thank you so much. Muchas gracias, and I look forward to conversations later on. Take care.
Thank you, Dr. Ramirez. And joining us today
Ya
is
se
a
enteró.
woman whose mission...
Ahora puede elegir Geisinger Health Plan Family como su plan de Medicaid. Con GHP Family tiene acceso a una red de proveedores y hospitales de todo el estado y una gama completa de beneficios. Todo lo que necesita para cuidar su salud y bienestar. Entérese de por qué GHP Family es una opción inteligente de Medicaid en ghpfamily.com/primer paso. Repito, ghpfamily.com/primer paso.
And joining us today is a woman whose mission and direction is to make better health easier for all. We are honored to welcome Kim Drongo, Chief Diversity, Equity, and Inclusion Officer of Geisinger Health Plans.
Tú me miras y me llevas a otra dimensión.
Buenos dias. Thank you so much. It's a pleasure to be here today. I just know that this conference is going to be an amazing experience, not only for me, but for each and every last person that is attending. Based on the welcomes that I've just heard, I've already been inspired. It is my pleasure to welcome all of you on behalf of Geisinger and our leadership, and on behalf of our amazing team, which is right here in front. I want everybody to say hello to the Geisinger team. Thank you all so much for being here. This is our second year participating in the conference, and it continues to get better and better for us. Just a little bit about Geisinger. Geisinger was founded by a woman by the name of Abigail Geisinger, and her mission was to make sure that everyone got the health care they deserve, to make health care better for her community in central and northeastern Pennsylvania. Fast forward 100 years later, her vision expanded Geisinger to the entire state. We are driven by the deep roots that we have in our communities, and we thrive on the diversity and the unity that we create in those communities as well. The next few days promises to be very enlightening, enriching, and engaging, and we are happy to be a part of that. You'll be able to see a lot of the work that we've been doing in the community, specifically around our fresh food pharmacy, feeding families across the state. You'll hear about a partnership that we've recently embarked upon with the Hazleton Integration Project. You'll get a lot of information about neighborly resources that we utilize to make sure that families and communities have the tools necessary to thrive. We're focused on the social determinants of health. We're focused on closing the healthcare disparities in all the communities that we serve. I'd like to take a moment to acknowledge the founder and the creator of this event, George Fernandez. You heard a little bit about his shared experience, his lived experience, and that's really a part of what we do at Geisinger. We want to make sure that we all know about the lived experiences that exist in our communities, and it's only through those stories, it's through those experiences, it's through our listening that we can create programs and services to serve our community. Today, we have the next couple of days, we have the opportunity to acknowledge the significant contributions of the Latino community, the vibrant culture, and we experienced that last night with some salsa dancing and some reggaeton. I learned that from Zumba, and I saw it last night, and I knew exactly what to do. We'll experience the cultures, the hard work, and most importantly, the resilience of a culture and a community that's making such an immeasurable impact on the Commonwealth. So we're here to celebrate the culture, celebrate the achievements, and the potential. So as we kick off this convention, as we kick off this summit, I think it's important for us to remember that our diversity is our strength, our unity is our power. Let's look forward to the thought-provoking discussions, inspiring stories, and unforgettable encounters. Thank you, George. Thank you, Latino Health Summit, for allowing us to be a part of this journey. And let's make the most of this wonderful opportunity to connect, collaborate, and to celebrate our Latino community. Thank you.
Thank you, Kim. While unable to be with us in person here today, we have a very special video message from Lieutenant Governor Austin Davis, youngest Lieutenant Governor in the country and first Black Lieutenant Governor in Commonwealth history. Please direct your attention to the screens for his message.
Hey folks, Lieutenant Governor Austin Davis here. I'm so sorry I couldn't be there with you today at your 4th annual Latino Health Summit. However, I want to take this moment to express my immense pride at the impactful work being done by the Latino Connection. You've been a driving force in creating a platform for open dialogue and collaboration around Latino health. This year's theme, Fueling Revolution, Inspiring Change, and Embracing Unity for Latino Well-Being, is exactly what we need. As your Lieutenant Governor, I share that commitment to unity. That's why the Shapiro-Davis administration reestablished the Governor's Advisory Commission on Latino Affairs. This commission, just like the Latino Health Summit, is all about ensuring all voices are heard. It allows us to gather crucial information about your experiences and needs, and empowers us to develop programs and services that truly benefit the Latino community here in Pennsylvania. No matter what you look like, or where you come from, who you love, or who you pray to, you deserve a seat at the table. The Latino Health Summit embodies that spirit, bringing people together to share knowledge, discuss critical issues, and celebrate the health and vibrancy of the Latino culture. Thank you and best wishes to everyone at today's 4th annual Latino Summit. I look forward to seeing you all soon. Let's work.
Please welcome next Melissa Miranda, CEO of Neighborhood Centers of Lehigh Valley.
Good morning, bienvenidos. I really can't say much more than what everyone else has said because it's been said so eloquently and beautifully, but I did want to say that being a child of 2 Puerto Ricanos that came here over 75 years ago to build a wonderful life, Pennsylvania is a great place for Latinos to live and succeed. Having witnessed it myself, I know that that's very true. I myself am here today on behalf of Neighborhood Health Centers of the Lehigh Valley, the community health center initiative that was started over 20 years ago. We are joined here today by STAR and Valley Health Partners, all of us here to improve access to care and reduce barriers experienced by many of our community, and especially our Latino community. We welcome everyone, and that's important for people to understand, everyone. Our focus are those that are struggling to access healthcare. And so I appreciate and value the opportunity to share that so that maybe a neighbor, a friend, a relative can actually access care without having the excess burden of maybe expense or concerns. I wanted to say I'm very excited about the agenda over these 2 days because they're highlighting important topics that are impacting our Latino community. Prevention efforts take everyone's commitment, and it takes time. Having been a nurse for over 30 years here in the Valley, we are still being impacted by obesity, asthma, diabetes, cardiac, and that's most of it is preventable. So please, I ask you all, just take a breath, put your phones on Do Not Disturb, and really be present. Generate ideas, ask your questions, share your concerns, because it's not an overnight fix. And we have this opportunity I appreciate having the summit here. I am so proud to host it here. I'm not hosting it, but they are. And so I ask you to take advantage of that opportunity today. Thank you.
Our next guest is a trailblazer with a vision as bold as his heart. We are honored to welcome Rafael Collazo, Executive Director of Unidos US Action Fund.
Good morning, everyone. Muy buenos días. On behalf of our president, Janet Murguía, and the nation's largest Latino civil rights organization, I'm proud to say that I am the National Political Director and Executive Director of our political arm, the Unidos US Action Fund. And it is such a pleasure and honor to be here with us today. I stand before you today here at the Latino Health Summit. This is such an incredible gathering. I just want to again thank, I know we're all very grateful to my brother, George Fernandez, and his incredible team for bringing together this incredible event. It's also a very poignant day for me, and a historical day in my life, because it's actually my first public appearance since my mother passed away about a month ago. Sonia Collazo, and I encourage people to Google Sonia Collazo and check out her obituary and the many accolades and homenajes that have been shared publicly. Was a trailblazing Latina leader who was really part of that first generation of Latino activists, and came here as a young single woman from the Campo of Puerto Rico to blaze a trail as one of the first Latino city workers in the city of Philadelphia, and decades of service in church and in community. And in her final days, she made it very clear to me that while she understood I would need time to grieve, she made it very clear to me that she prepared me for this next stage in my activism. And she was very clear that the stakes could not be higher. And so today is such a historical day for many reasons, because we are in a moment in our history here as Latinos of Pennsylvania where the stakes could not be higher. The protection and the expansion of healthcare and culturally competent healthcare access and quality healthcare for the Latino community is on the line in 2024. And so we're very proud to stand with the Latino Health Summit, all of our allied stakeholders here from all the different sectors of the healthcare system, to stand in unity to say that we're not going to go backwards as it relates to progress that we've made, whether it's the Affordable Care Act, the gains we made in the Inflation Reduction Act, and other efforts that we've all made here on the national and state level to expand quality health care for all the Latino community. We're proud to say that later on in the day that the Unidos US Action Fund is going to announce at a press conference that'll be here at the Latino Health Summit, not our Pennsylvania Latino Health Agenda for 2024, our national Latino Health Agenda for 2024 is going to be announced here at the Latino Health Summit, along with Latino elected officials and other stakeholders. And we will lay out what policies we want to collectively work on together with stakeholders and elected officials to continue to expand access to Latino health care for the Latino community, for our immigrant population, for our young people, which, too many of which are dealing with issues related to healthcare access and food insecurity, and a myriad of solutions, as one of our other speakers spoke about a moment ago, where we can expand access to healthcare. 40% of Latino voters in Pennsylvania tell us in our polling that healthcare access still to this day in 2024 is a top concern. So there's much work to be done, but I know with the leadership in this room, we're well on our way. Thank you so much. You can follow Unidos US Action Fund, if people can get to the last slide. For more information, we have a QR code here where we're going to be announcing our Latino policy agenda and ways you can work with us to mobilize the community around policy on a state and national level to expand healthcare access for the Latino community in Pennsylvania. Muchas gracias.
All right, and after all these powerful remarks, we are finally ready to kick off our first panel of the day. To lead this conversation, I am very excited to invite to the stage fellow journalist and currently communications manager for the city of Allentown, Genesis Ortega.
Welcome, bienvenidos. Un aplauso, round of applause to everybody in this room. This is incredible. Welcome to the Lehigh Valley. My name is Genesis Ortega, and I am proud to be your host for this first panel on what Pennsylvania is doing for Latinos. And as George Fernandez says, are we addressing the root causes of health disparities? We know very briefly that Latinos are the fastest growing segment in our country. And in Pennsylvania, we have accounted for more than 50% of the growth in the past 2 decades. In Allentown, we have over 54% of our population that is Latino, Bethlehem, 33%, and Easton, we have 25%. So it's a significant population, and this is a really important conversation. So without further ado, I am proud and honored to be sitting alongside some of Pennsylvania's leaders to talk about these issues that we have for today. So joining me on stage is Secretary Valerie Arkoosh of the Pennsylvania Department of Human Services, Acting Secretary Debra Bogen of the Pennsylvania Department of Health, and Secretary Pat Browne, Pennsylvania Department of Revenue. Give us a round of applause, and I'll have them join me on stage.
You're on the front line, everyone's watching. You know it's serious, we're getting closer, this isn't over. The pressure's on, you feel it, but you got it all, believe it. When you fold it up, oh, and if you fold it up, cause this is Africa.
So, it's a great Shakira song. So just to give you some perspective on who's joining us, I just want to read some brief bios because these are some really incredible people joining us today. So Secretary Valerie Arkoosh assumed her role as the Secretary of Pennsylvania Department of Human Services on June 29th, 2023, following her appointment by Governor Josh Shapiro on January 17th. Before this, she served on the Montgomery County Board of Commissioners, becoming the first woman to chair the commission. Her tenure saw significant strides in addressing homelessness, strengthening human services, and combating the opioid epidemic. During the COVID-19 pandemic, her leadership was commended for its transparency and data-driven approach. Dr. Arkoosh is a strong advocate for maternal health and reproductive rights and previously led national efforts for comprehensive healthcare reform. She brings a wealth of experience, including a medical background as a clinical anesthesiologist and obstetrician, along with a Master of Public Health. Welcome. And Dr. Debra Bogen serves as the Acting Secretary of Health, bringing a wealth of experience from her tenure as Director of the Allegheny County Health Department. During her time there, she provided invaluable leadership during the pandemic, ensuring the dissemination of accurate information and close collaboration with stakeholders. Dr. Bogen's extensive background includes over 2 decades in the Pittsburgh medical and research community, where she held academic appointments at the University of Pittsburgh and UPMC Children's Hospital. Her dedication to pediatric care and addressing social inequities is evident in her clinical research. Dr. Bogen received her medical degree from the University of Colorado School of Medicine and played a pivotal role in founding the Mid-Atlantic Mother's Milk Bank. Welcome. And the Lehigh Valley's very own Pat Browne serves as the Secretary of Revenue, bringing a wealth of experience from his nearly 3 decades in Pennsylvania's legislature. Representing Lehigh and Northampton counties, Browne served in the Pennsylvania State Senate for 18 years and previously in the State House of Representatives for a decade. Notable for his leadership as Senate Appropriations Committee Chairman, Browne authored key legislation reforming Pennsylvania's public pension systems and spearheaded initiatives in education and government reform. His efforts in creating the Neighborhood Improvement Zone revitalized Allentown, attracting over $1 billion in new development investments. Browne's background as a certified public accountant and attorney further enriches his public service. He's a graduate of the University of Notre Dame and Temple University School of Law. Welcome. And so we're excited to have all of you here. And what I'd like to do is just begin by having you introduce yourself and giving us a high-level overview of your departments and your role and what work you're most interested and most excited about within your department. I'll start with you, Dr. Bogen.
Yeah, there we go. Good morning. I can't really see people out there. It's really, first of all, thank you so much for having me. It's a real honor and privilege to be here. So as you said, I am Dr. Debra Bogen. I am a pediatrician. I'm also a mother. So I think I bring those to my work every day. At the Department of Health, we have a vision, which is a healthy Pennsylvania for all. And I think that really speaks to the speakers we heard at the introduction, really about the importance that we have a healthy Pennsylvania for all. And that all is what I want to emphasize. And that's really at the core. We, at the department, put out lots of reports, but one of the most important reports is we do something called a State Health Improvement Plan. And that State Health Improvement Plan is our 5-year plan of how we're going to improve the health of Pennsylvanians. And at the core of that is health equity. So that is, which I'll try to talk about a little bit more during the questions. But what we do in the Department of Health is we try to prevent epidemics and the spread of disease. We protect against environmental hazards. We respond to disasters and assist in the recovery of them. We try to prevent injuries, promote healthy behaviors, assure quality and accessibility of health services, and collect and analyze data to inform actions. So that's sort of the core of public health, and we are a public health agency. We put out, like I said, a lot of data on many topics. And our priorities this year are many, but one is maternal health, and working very closely with Dr. Arkoosh and her team and our drug and alcohol programs and a number of other agencies really on maternal health. Rural health is another really important core mission that we're working on at the department, and access to care across the Commonwealth. We are an interesting state. We have 3 or 4 kind of urban areas, and then we have lots of rural communities across the Commonwealth where access is challenging. We are really working with the rest of the administration on behavioral health and mental health access, including substance use. And emergency medical services, I know every day I want to make sure that if I call 911, I have access to emergency services. So the EMS system, which sits under the Department of Health, is another really important area, as well as our commitment to continue to improve long-term care facilities and the quality of care in those facilities. So those are some of our important highlights for the Department of Health at this time.
Secretary Arkoosh.
Good morning, everybody. It is such a pleasure and an honor to be here with all of you. I am Val Arkoosh, and I am the Secretary of the Department of Human Services, and really excited to have this opportunity to have this conversation with you today. The Department of Human Services is the Commonwealth's largest state agency, and under our umbrella, we have a number of programs that help build bridges to stability for families all across our Commonwealth. We oversee the Medicaid program, which is known as medical assistance in the Commonwealth, and we also establish access to all sorts of other really important programs, like SNAP, which is the Supplemental Nutrition Assistance Program. We can provide heating assistance. We can sometimes help with emergency housing assistance, a number of programs like that. But we also work to help individuals with behavioral health challenges, individuals with intellectual disabilities and autism, folks with physical disabilities that need supports to maintain a home in the community. We work in child welfare and also the juvenile justice system. And we also help provide child care and early intervention services. So we run a wide gamut of services. One of the ways that you might have interacted with us is in our county assistance offices. That's often the kind of the front door to getting assistance with providing stability for a family here in the Commonwealth. We have offices in every single county. And I'm particularly excited to be here today because, as Genesis mentioned, the Latino community is growing and thriving in the Commonwealth and is just such an important part of what we do. And I personally believe that while we do a lot of things fairly well at the Department of Human Services, there's always an opportunity to improve. And we want to work in partnership with you. We look for you to help hold us accountable to make sure that we truly are accessible, that our language services are appropriate and adequate to the tasks at hand, that we are making our services readily available and convenient. And we look forward to getting your input, to working in partnership with you with that goal of making sure that every single family, every single person in our Commonwealth has the chance to grow and thrive, live with dignity and security that they deserve. Thanks.
Secretary Browne.
Genesis, thank you. On behalf of the 2,000 members of the Department of Revenue team, buenos dias to all of you, and wanted to take an opportunity to thank you for having the fourth summit in the Lehigh Valley. The Lehigh Valley is my home, and given the strength and the importance of the Latino population here in the Valley, it's highly appropriate to have this summit here. The Department of Revenue, pretty simply, is responsible for effectively and efficiently raising the revenue that's necessary for a state government to operate, for its operations and its programs. And one thing that's really important to always keep in mind is for any state that needs to balance its books, the strength of its revenue depends on a productive population. The states that are growing in their population are the ones that have the strongest revenue base. And for the last 30 years, for my service in state government, that has really depended on the growth of the Latino population in Pennsylvania. If it wasn't for the Latino population seeing Pennsylvania as a place to raise their families and invest, the state of Pennsylvania would be shrinking. So it's very important for me to note that, because your investment here and the families that live here has been extraordinarily important to the revenue base for the Commonwealth of Pennsylvania. Given that it's 3 days after tax day, I'm probably the last one you want to actually listen to. My 2,000 people are pretty tired right now. But the one thing that is never on the top of the list in terms of favorite things to do is to pay your taxes. So it's up to the Department of Revenue to have a system that's as effective and efficient as possible to make it easy on folks to do their collective obligation as being citizens of Pennsylvania. And probably the most exciting thing for me over the last 5 years has been the Department of Revenue has really been a department that was in the past for years. Its systems were not up to date. It was very hard for taxpayers and businesses to comply. Over the last 5 years, we put a major amount of investment in our tax compliance systems. What used to be the oldest and least efficient in the nation is the most integrated and most efficient in the nation, and it just makes it easier for folks to comply, and that's really important.
Thank you. Secretary Bogen, I want to know, what are the biggest challenges and opportunities for Latinos in the state of Pennsylvania? And the question that I believe many are asking themselves in this room is, what is the role of Pennsylvania state government in addressing those challenges?
Well, thanks for that. The state government, which I'm learning as well in my new role, really means we all have to work together. And no one department does it all. So, Dr. Arkoosh and I and the other, what we call health hub secretaries and aging and drug and alcohol have to work together to really address those opportunities. So no one department really owns it all. I think there's a number of challenges. The Latino community is diverse as the rest of the country, right? It is not one group. It is many, many people. So, some Latinos have been here for generations and generations, and some are new. And so it's hard to say, there are challenges for individual people and for communities. We do have a lot of data. So one thing I will say is our data definitely show across the state that the prevalence of poverty among the Latino community is almost twice as high as in the rest of the population. So that's certainly a challenge. And access to care, which I think was mentioned earlier as well, continues to be a challenge. And almost twice as many Latinos will say that they don't have as good access to care as they would like compared to the general population. So that's a huge challenge that we all need to work together to overcome. And many people across the country, the pandemic did not make this easy for people, but mental health has really been, and behavioral health has really been a challenge, and accessing care. There are movements on that. I think, again, telehealth has allowed that to improve, but I think those are some of the major challenges facing the general population, but also the Latino population. So our role really in government is to make sure that we use our dollars that come into our programs to make sure we're using those effectively to get to the communities in need that need them the most. And again, that is where health equity comes to the core, right? We get federal dollars, we get state dollars, and we need to make sure that we work with communities to deliver those dollars most effectively. So when I was at the local health department, we worked really hard to identify communities in need and make sure that local organizations that were doing the work, boots on the ground, were getting that financial support they need to deliver the services. So the Department of Health, we don't deliver a lot of healthcare services, although I will mention we have state health centers, which I'll talk about a little later. But really our job is to make sure that we distribute those funds appropriately to get to those most in need. And I think that's really at the core of what the government needs to do as a team of people. And we use data to make those decisions. So we put out from the Department of Health tons of data. It's on our website. We have open data, we have dashboards, and we hope that people across the Commonwealth use that data in their local assessments so that they know also where those needs are. And that, to me, is at the core of the work we do, is really that equity and making sure we're using that data to effectively drive it. So it means we have to collect good data as well to make sure that it can be used most effectively.
And that's a really good point. And Secretary Arkoosh, I'd love to hear your perspective on the equitable distribution of resources. Are there initiatives in place to ensure that these resources are being equitably distributed when we're talking about services for these communities?
Yeah, I think that the short answer is yes, but that's also one of our biggest challenges, is actually connecting with the individuals who have every right to receive certain services, but may not know that those services are available to them. They might know they have a need, but they're not sure where to go to solve it. So I want to mention a new program that is just being launched across the Commonwealth called PA Navigate. And PA Navigate is it's a system that will connect hospitals, doctors' offices, emergency departments with community-based organizations, everything from food pantries to other broader community-based groups, and also to county governments, where a lot of health departments and other services are delivered out through that county level. And this will be an interactive, it's called a closed loop referral system. And a doctor can make a referral for an individual to a local food pantry if that person is insecure. Or any Pennsylvanian can just go on to PA Navigate and they can search by zip code and they can select any services that they're looking for help connecting with. Housing, childcare, food, clothing, whatever it is. So I think anything that we can do like that to help make it easier for people to connect. The other area that is so critical for us is making sure that we are working with trusted messengers across our Commonwealth. We recently we're recently wrapping up a process that once the pandemic ended, we had to go through and have every single person who was receiving Medicaid services, their health care through Medicaid, which a year ago was 3.7 million Pennsylvanians, none of whom lost their coverage during the pandemic. Every one of those people had to send in paperwork and reapply for their Medicaid. And we are seeing, as we are concluding that process, that despite really substantial efforts, despite reaching out to people 11 times, despite community events, despite radio, television, all sorts of things, there are people that just never responded. And we've been doing some work to survey individuals who didn't respond. And no surprise, one of the issues that's bubbling up are individuals who speak Spanish as a primary language. And so we know that language access is not simply a matter of translation, it's about appropriate interpretation and making documents and other things culturally appropriate and welcoming and just simply to make sense. And so I think that's a place where we really have work to do and very much hope that we can do that work in partnership.
I appreciate that. And considering what you just said, Secretary Browne, I'd love to hear your take on this particular situation, reaching Latino families, considering the socioeconomic challenges that many Latinos face. How is the Department of Revenue tapping into that community to let them know about things like tax credits, financial assistance programs, resources that might be available to them?
Thank you. As I had said, the tax system is, in order for it to work effectively, it has to be accessible. It's not something that we covet all the time having to involve ourselves in, but it's something that if it's not accessible across the board to the different populations in Pennsylvania, it's not being run effectively. So it's been the priority for our department in the past administration and under the Governor Shapiro's administration to make sure that's the case. Recently, we had made sure that in our new system that the filling out of the Pennsylvania income tax form could be, the instructions would be in Spanish. We're working on making sure that the tax return, which is something that most have already complied with this year, but for next year, will be in Spanish. One of the governor's major initiatives this year was to expand a program in the lottery. That's another thing the Department of Revenue is responsible for, is running the lottery, the tax and rent rebate program. The first expansion that has been done since 2004, families that were making $15,000 now making $45,000 can qualify. And for the first time, the instructions on the form has been translated into Spanish. There is a couple very important initiatives that the governor and the assembly had partnered on just recently, and one that is very important is the Child Independent Care Credit. It's been something that's been in the U.S. federal system for years, but now under the Pennsylvania system, families with children can receive thousands of dollars in tax credits for child independent care expenses. That's something that was only 30% last year. This past budget, they made it 100%. So these types of initiatives, I believe, are really important, not only from a standpoint of accessibility, but taking care of the income and challenges that Latino families have in being self-sufficient.
Something that our federal, state, and local really officials are dealing with right now are how to work with immigrant and refugee families. And so I would be curious to know, how is state government handling getting information and access to resources to these communities?
So the department, our public health system in Pennsylvania is unusual. We have a hybrid public health system. So we have 7 local health departments, and we have 4 municipal health departments, including one here, local health department, or municipal health departments. So and then the rest of the state, in all the counties, we have something called state health centers. And those state health centers serve the community in which they live, and they provide vaccinations for people who are underinsured or uninsured. insured. They provide testing for sexually transmitted diseases. They treat tuberculosis. They do community education. They track infectious diseases and other things. So in all of our communities across Pennsylvania, we have state health centers. And those state health centers are intended to help support the needs of immigrant and refugee populations. Recently, in our Bureau of Community Health Systems did a local collaboration in the library to address some needs of recent immigrants in one of our communities that had seen a large influx of Haitian refugees. And again, that's the kind of work that we do to try to make sure when there's a community in need that we get out there and work with local partners to address those needs. And again, we saw that in the pandemic as well. We also have the WIC program in the Department of Health, and the WIC program is one of the nutrition programs that serve people in the United States, and it's particularly for pregnant and postpartum mothers, as well as children birthed to their 5th birthday. And that program and the WIC program across the Commonwealth and every county has programs and offices and does a lot of outreach, including having services in many languages and translated many materials. Our websites are available, and our app also does that. So we also really work with organizations that provide services to refugee and immigrant populations. So we work through many means to address the needs. Again, I just want to comment a little bit. Dr. Arkoosh mentioned the need for really making sure all of our services are in multiple languages. We have refugees and immigrants from many, many places that speak many languages. And we still have a lot of work to do to make sure that all of our services can reach everyone. Again, that Healthy Pennsylvania for All is at the core. And if we can't communicate with people effectively in a culturally appropriate way, then we're not able to reach them. So we're continuing to do that work, making sure we're responding to individual needs as they come up. But again, trying to plan for the future of what does that look like? How do we use the best technologies out there to make sure that we are reducing barriers to care, whether it's through any of our programming and our partnerships with other organizations.
I'm glad to hear that. And I don't know if you are able to answer this question, but I'm curious, how do we stand with other states and other commonwealths? I think there's a few other, right, commonwealths in the country. Is there a gauge? How are we in comparison to everyone else?
I think it depends on what you're talking about. I mean, our WIC program, for instance, is working extremely hard to increase access to services. So I don't have metrics in terms of that, but we do, for instance, have working on 8 mobile units to get out to the community. We're really trying to find ways to meet people where they are. I hope we're doing well compared to other states. We certainly make every effort to, but I don't have any data on that.
Let's talk social determinants of health for a second. And Secretary Arkoosh, I love to hear your perspective first. And if anybody else also wants to chime in, what are we doing? What policies, measures are in place to address things like housing instability, food insecurity, employment disparities, and disproportionality as a whole in Latino populations?
Well, this is an area that I'm particularly excited about right now. Historically, at the Department of Human Services, we have been supporting people and helping to build those bridges sort of in the immediate moment for immediate healthcare needs, immediate hunger needs, things like that. But I know as a physician that if you look at the overall impact on healthcare, not on healthcare, but just being healthy, about 20% of being healthy comes from a care provided by a physician like myself. About 50% of being healthy comes from where you live, what food you have access to, things like having access to a job that pays a living wage, having transportation, living in a neighborhood with clean air and clean water. And so while we do our immediate work every day at the Department of Human Services, we are very focused on moving upstream and working on prevention, because so many things can be prevented if people just simply have access to the right supports and food at an earlier time in their life. And so I'm very excited that under President Biden's administration, they have created the opportunity to spend Medicaid dollars, which historically have only been able to be used for health care. We now have an opportunity to spend those dollars on health-related social needs. And so our agency has submitted something called an 1115 waiver to the Center for Medicare and Medicaid Services in Washington, D.C., and we're in the process of negotiating this waiver with them. And if we are successful, then we will be able to, for 5 years, work on 4 different things. One is funding for food as medicine. So for individuals that are in the Medicaid program, certain individuals that have a newly diagnosed condition like diabetes that's very sensitive to the food that a person eats, we'll be able to support them with some food assistance for a period of time, help them, again, get stabilized, get on their feet, and understand how to manage their condition. We will also be able to provide short-term housing supports for people who are unhoused, for people who have given birth or are pregnant. Make sure that certain populations are able to get stabilized in housing as quickly as possible. And again, then sort of be that bridge to get that person to a little more stability so that then hopefully a community-based organization or a county-funded resource can then take over from there. There's a package of services for individuals who are re-entering our communities after a period of incarceration. These folks face enormous challenges with housing, with getting a job, with having access to health care, and a number of other challenges. And so there would be a package of supports for individuals in that situation. And then very importantly, we are asking to continuously cover children from birth until their 6th birthday in the Medicaid program. So if they qualify for Medicaid at any point from birth to their 6th birthday, once they're in, they would stay in. And that is so important because, as Dr. Bogen can tell you as a pediatrician, those early intervention services around language or physical therapy or behavioral health issues that are identified young, when we can intervene early, that has life-changing impact for these kids. But we also see that our children have some of the most frequent, what we call churn, rolling on and off of Medicaid. And it's not their fault. If they happen to have a parent who has seasonal employment, for instance, they may qualify for Medicaid during some parts of the year and not qualify at other parts of the year. And so that really creates a very challenging healthcare situation. So we want those kids in particular to be able to be covered. So we're very hopeful that we'll get the go-ahead sometime this fall. Then we'll need to be working with our General Assembly members to fund the budget that will make these tools possible, but these tools also come with really substantial hundreds of millions of dollars of federal investment into the Commonwealth. So it's just a win-win all the way around.
And Secretary Browne, are you involved in that effort to make sure that's successful?
Anything I can do, it's a very important
He's got to collect the money so that we can.
It sounds like translation efforts are underway in each of your departments to make sure that there is access to this information in multiple languages, but that's the first step. So are there any other efforts underway, or what are our state agencies doing to ensure that literacy, cultural barriers aren't in the way of individuals and businesses here in the Commonwealth?
I can add just one other quick thing, which is that, and Dr. Bogen talked on some of this work a few minutes ago, just the importance of being present in communities. And so through our Medicaid managed care organizations, they are all able now to hire and pay community health workers. I think community health workers are such an important group. They are trusted messengers. They understand the needs in the communities in which they're working. They become expert in how to connect with the resources resources in those communities. And let me just say, once again, they're trusted. And so continuing to support that workforce, really, really important. We've also made it possible in the Medicaid system for certified doulas to enroll as providers in Medicaid. Many women of color find it very challenging to be pregnant and give birth in our existing medical establishment. It is well documented that birthing people, particularly women and birthing people of color, often do not feel heard, or they aren't heard, or their wishes aren't respected, or they're not taken seriously. And a doula can help, again, bridge that gap and make sure that that woman is heard. And so we're working very hard on efforts like that to expand who is able to assist individuals across our Commonwealth, and we want to continue to bolster those efforts.
I know at the Department of Health, we have an Office of Health Equity, which has been in place since, I think, 2007. And that office has really been leading the charge and making sure that we all are thinking about language access and culturally appropriate services and care. So I really appreciate the leadership that that team has taken. We know, so for instance, we have been doing with all of our training, all of our staff are getting training in language access services, again, to make sure that this is front of mind for people as they develop programming and thinking about culturally appropriate care. And again, you know, we have contracts with agencies for translation, but making sure that translation isn't just word for word, but really gets at the meaning of the communication. And I think training our staff is a start, but not the end. The other thing we really do is we work with community organizations to try to understand the local needs as we work with our contracted agencies and things. So making sure we have diverse organizations with whom we're working to really address the needs of every community. You know, that is one of the roles of government, is to distribute funding and making sure that that funding is meeting the cultural needs of people. Diverse communities is really at the core of the work.
Is there anything you'd like to add?
Yeah, well, along with these comments, the thing that's most important for us to always consider is accessibility. If our systems that everyone has to participate in aren't accessible, then they're impossible to comply with. So it's one of the things that's been very important to us, together with my colleagues, is outreach. We have 9 separate offices around the state that are responsible for connecting with taxpayers. One of our priorities has been to hire Latino members of those outreach offices. We've hired people in the Lehigh Valley, people in Philadelphia, people in Pittsburgh that can directly interact in Spanish with our Latino population. Again, I mentioned the need to have all of our forms, which we are doing over the next year, making sure all our forms are not only in English but in Spanish, and ensuring that we go beyond what we normally do in making ourselves accessible. This year alone, we're having 300 separate outreach events around the state to help people with their compliance with the income taxes, sales tax, and also for the governor's initiatives on property tax and rent rebate to make sure that the 200,000 folks that were able to assess the new child independent care credit, the 175,000 new citizens that can receive benefits for property taxes, have the assistance they need to make sure that happens.
I want to go back to something that you said, Secretary Arkoosh, and you know, I have heard anecdotally as well that, you know, people of color do have challenges when it comes to receiving services, you know, in our healthcare systems. And I mentioned earlier that Latinos are the fastest growing segment of our population. And if we see these numbers continue to rise, will our healthcare systems be ready to embrace that changing demographic? And what can we do to help?
Yeah, I think that's a really great question. I do think that our health systems understand how important that is. And where you see that understanding being realized is an effort to make the individuals that work on our healthcare systems reflect the communities that they're serving. And so that means making sure that people see healthcare careers as something for them. And that starts, in like grade school and junior high, and for sure by high school. We all need to work together to make sure that our children see these paths ahead of them. The governor has been just a real leader on focusing on helping make education more affordable for individuals. Dr. Bogen and I are always talking about programs for loan repayment. There are some already in the Commonwealth, but we really do need more. And those programs can be tailored to focus on lifting up where our greatest needs are, which are often in communities that are more diverse and more reflective of our growing communities here in the Commonwealth. So we're really eager to be part of those efforts. And again, I go back to what I said at the top of this, that's where we need you. We can't sit in Harrisburg and answer these questions ourselves. We need your input, we need your partnership, we need your ideas so that we can do things that actually are going to work and are going to be meaningful to the communities that we're all trying to serve.
And it goes back to something that Secretary Bogen said, is that it takes everybody to be part of this effort. Is there anything you'd like to add to?
No, again, I really do think that local people know their communities best. They know what their communities need. And it's important for people to lift that information up so that we can work together to support those local efforts. And I've been to now many WIC clinics across the Commonwealth, and they're all slightly different. They all deliver the same kind of services, but they know what they need in their community to meet the needs of the individuals. They make connections to healthcare services. And so we rely on local agencies to do that work. So the money flows from the federal government through the WIC program to the state government and then out to all of our community partners that deliver those services. And that's true for everything that we're talking about, right? I mean, Dr. Arkoosh's team does that. We have partners, and those partners are the ones who actually deliver the care. And so we rely on you as local people to tell us what each individual community needs. There are 67 counties in Pennsylvania. Everyone is unique. In Allegheny County, where I come from, there are 130 municipalities, and they're all different. And the most effective care is that is delivered by local people in their community, which is why community health workers are so important, because they live and work and know the community they live in. So again, I think that's why we're here, is to let you know that we are listening and we want to be partners with all of you to make sure we are getting the care in local communities by local people in the way that they need it.
I feel like you can't have a health summit without talking about the COVID-19 pandemic. And I was a reporter during that time, during COVID-19, and I covered some of the challenges that government agencies, healthcare facilities had with the Latino community and vaccination and getting information out. So I'm wondering, in light of the COVID-19 pandemic, what did we learn here in Pennsylvania, and what are the solutions that we're implementing to address some of those things?
So the COVID-19 pandemic was I joined public health in March of 2020, having come from academia. So I also, along with you, lived through the pandemic with very specific eyes. And I think I learned a lot during the pandemic. And I really think that experience is important. One of the most important things we learned during the pandemic is the need to have pre-existing partnerships. And rather than build a plane while it's taking off, we need to have built it already. And so we are at the Department of Health, and I know in Human Services and other organizations, now that we have those connections that we made during the pandemic, including with the Latino connections and with other organizations, we need to maintain those connections so that when the next, I don't want to say it, in the next emergency, we are prepared to deliver services quickly. Again, those services are delivered locally. Vaccinations were delivered locally. Testing was delivered locally. And so we need to make sure that the connections are made and maintained. And I think that's the most important. So, one of the things that I'm working on in the department is to continue to make sure that we know how to reach every community quickly through their leadership so that we can get information quickly that's accurate, that's timely, and because information changes, right? Every day during the pandemic, something new came out. So we have to make sure that our messages are clear, but also honest to say, we know this today, but we don't know if that will be true tomorrow as science is an evolve. That's why I became a scientist, is that it's constant learning and you're learning new information. So we have to deliver that information with the humbleness and honesty that we know that sometimes we don't know it all right away. We didn't know anything about the virus at the beginning, and we learned about its transmission. We learned how to treat it. We learned things evolve. So communication, but making sure that we have connections to every community so we can communicate in the language they need to. I know, for instance, in Allegheny County, I went a number of times to the Bhutanese community with a translator, did events online for them to try to reach them. We did other events in other languages. Again, I don't speak any other languages, so we went with community members and translators to the community to talk to them. And we have to maintain those connections to be able to respond in the next emergency.
Secretary Browne, I know the pandemic was before your tenure as Secretary of Revenue, but how did the pandemic touch the Department of Revenue?
One thing that obviously we had to put together a system to respond to the pandemic. But one thing that we were really worried about at the time was how it was going to affect our finances, because the Pennsylvania economy, like the economy across the country, was shut down for a month. Something we hadn't experienced before, and there was really no history to go by. So, when we were trying to develop a budget at the time, we decided to do a 5-month budget, which was never done before. So we were looking at this as something that would really affect the Department of Revenue's ability to fund programs at the time. But there has been some silver linings, and one of the silver linings of the pandemic is we've never been, at this point in time, never been in a better financial position than we are right now. The people of this Commonwealth, Latino community and the rest throughout the state really buckled down and did whatever they can to get through that period of time in the most productive way possible. And because of that, in 2019, the state had a rainy day fund of $256,000. Now our fiscal balance is $11 billion. And that occurred, thank you. And that occurred only because of the Latino community and the citizens of this Commonwealth during the most difficult time that we could possibly have, maintained their businesses, kept operating their businesses, kept on employing people. And we are in a stronger place now than we were before the pandemic. And that is something that we didn't expect. We didn't expect that to happen, but there was a silver lining.
I'm being told we have 3 minutes left, and so I will give our panelists about a minute each to just share their final thoughts with the crowd. You can start, Secretary Arkoosh, yes.
Well, again, thank you all so much. Really appreciate this opportunity to talk for a few minutes with you today, and just look forward to continuing to work with you. I firmly believe that we have challenges all across our Commonwealth, but that the people who are in the communities that are experiencing those challenges, they know how to solve those problems, and it's my job to listen, to just listen and understand what can we do with our resources to connect those dots, to build those bridges, to make it easier to access resources, and to make sure that it's done in a way that's safe and dignified and actually gets the job done. So I hope that you feel very much that our door is open. We have county assistance offices all over the Commonwealth. My team and I would love to hear from you with your ideas, and we hope that we can go forward in partnership and make sure that every Pennsylvanian is healthy, thriving, and living their life with security and dignity. Thanks so much.
Thank you. Secretary Bogen.
Thanks. So first, again, the vision of the Pennsylvania Department of Health, I'm sure you all share that, which is a healthy Pennsylvania for all. And that means we all have to work together. So we're looking forward to partnering with all of our communities to make sure we're achieving that health. We have a number of programs that I want to make sure you all know you can participate in. So we have our State Health Improvement Plan, and we have committees and people who join those calls to work as working groups. So if you're not already on a committee and want to join our State Health Improvement Plan team, we welcome all to the table. So if you go online to our State Health Improvement Plan website, you can find how to reach out and let us know you want to participate. Again, you need to be at the table to be able to help us make sure we're achieving what we need to together. We have a number of resources and data. Please, as you're writing your grants and your organizations are working to get those dollars to do the work you want to do, please reach out. If there's data that you're missing from our website that you think would be helpful, please let us know that so that we can make sure we're meeting the needs that you all have as individuals and as organizations to be able to apply for those dollars. But we're here to partner, like Dr. Arkoosh said. We're here, we're listening. We really appreciate all that you do as individuals and organizations and as a community, and we want to partner with all of you. So thank you so much for having me. It's really an honor and privilege to be here and to serve the Commonwealth.
Thank you. Secretary Browne.
And thank Genesis and congratulate her for her service to Allentown. Just wanted to thank all of you for the opportunity to be with all of you today. Nothing more exciting than talking taxes at a casino, I know that. But I hope I didn't put you all, at least I didn't put you all to sleep today. But the one thing I just wanted to mention, we are trying to make our district offices more reflective of the populations throughout Pennsylvania, and we're currently still in a recruiting initiative across the state for Latino members of our team. Not only in the Lehigh Valley, but throughout the state. So as you go back, if there are folks that you know, they're looking to reach out and be part of our team, I wanted to encourage that so that we can continue to build on the strength of the Department of Revenue on behalf of our communities. Thank you.
Thank you. 3 of the people at the forefront of making sure that Pennsylvania state government is addressing the health disparities that exist within the Latino community, and we thank them all for their work and their effort. Thank you all. We hope that you enjoyed this panel and enjoy your day. Thank you.
Thank you, Genesis, for leading this conversation. And of course, thank you to our panelists and the offices that they represent for addressing this topic and for so gracefully diving into the complexities of this conversation. Up next, we have breakout sessions, very interesting questions. So if you're not sure where to go next, please refer to the screens on the side of the stage to see what we have. And as a reminder, our friends from Unidos US Action Fund are having a press conference at 11:30 a.m. at the VIP room. If you are not sure where that is, you can just ask any of our staff members and they will gladly point you in the right direction. All media members are required to be there and any other guests that would like to hear the very interesting news that they have to share with us.
You're on the front line, everyone's watching. You know it's serious, we're getting closer, this isn't over. The pressure's on, you feel it, but you got it all, believe it. When you fold it up, and if you fold it up, tamina, mina, sangalewa, 'cause this is Africa. Tamina, mina, waka, waka, tamina, mina, sangalewa, this time for Africa.